So good ICU means the good nursing care. So good ICU doesn't mean the good doctor. So it means that if you have a good, nice, excellent care providers in terms of nursing, this means that they are a good intensive care. And apart from this, as Dr. Faisal mentioned, the ancillary service. So that's why the meaning of the multidisciplinary care that we have started, the pharmacists, they should be there. This is their mandatory part, that they need to come to the ICU, the physiotherapist, and of course we have started last year in the COVID day the respiratory therapist as a service, 24/7 service for the advanced respiratory care to the patients, and we are working on that, how this can be extended from adult to the pediatric and from ICU to the special care, so that the patient would get more benefit in terms of it. And now, I'm just wanted to give you a brief about how this adult intensive care created an impact. So I'm not going back then 10 years back. I'm just giving you three major examples that what we have done in the last 5 years. Uh, the first thing we have done, and again, this was a mutual agreement, mutual work between the surgeon, the microbiologist, the ICU physician, and the nursing, and the ID, the antibiotic stewardship. And I totally aware that Dr. Anwar was the first person who started antibiotic stewardship in the ped intensive care unit, and it created an impact. And we were the second one in 2016. And the model was slightly different because in the ped intensive care, the pharmacist was the lead that started. And, he created that sort of philosophy that apart from the doctor, the other would come. But in the surgical ICU, we created a model of intensive care physician-led the antibiotic stewardship, because our model is a collaborative. So our surgeon has some strong hold. So we said who can come in front of them and talk to them. So that we said, okay, the intensive care physician should, and it created an impact in terms of the patient outcome, the length of stay, but more than this, the cost. And we cut down the cost of around 2.3 million in 6 months. So it means that how much aggressively we use the antibiotics in our setup.